Hi, my name is Dr. Azlindarita Aisyah, Mama Abdullah. I am a mother of 4. My children are 17, 16, 14 and 8. I am also a consultant general and pediatric ophthalmologist here in MSU Medical Center. There are a lot of common eye diseases in children. As a pediatric ophthalmologist, I see cases from congenital to non-congenital diseases. Congenital cases are the ones in which the children are born with it. Sometimes they manifest while the children are being born or a bit later, for example, after 6 months. Non-congenital cases are usually will appear after the children a bit bigger, maybe after 1 year old. So if you have to ask me, I can tell you the commonest eye diseases in children in Malaysia is refractive error. There are numerous types, but I can tell you 3 types. Number 1 is short-sightedness, long-sightedness, and astigmatism. Besides that is amblyopia, which is lazy eye, and also strabismus, which is misalignment of the eye. In Malay, we call it juling. Lazy eye, the medical term is amblyopia. So in amblyopia, if you look at a child, or if I as a doctor examine the child, the eye looks perfectly normal from anterior to the back, from the cornea to the retina. Everything looks normal, but the eye cannot function normally. For example, if the child had lazy eye in one eye can see 6, meaning they can read the chart from top to bottom, but the other eye cannot. Maybe can see 1 line, 2 lines, or up to 3 lines, but it's not the same with the other eye. So why does lazy eye happen? Usually it happens because there is some disruption in the visual pathway while the child was still small. For example, if the child has refractive error in one eye, this causes the eye to have good vision in one eye but poorer vision in the other eye. So this causes the brain to prefer the eye with good vision and neglect the eye with the poorer vision. This is why it's called lazy eye. I always try and explain to the parents that it's not the child which is lazy, it's the eye which is lazy. It's actually not the eye which is lazy, it is the brain which has preference to the eye which has clearer vision than the other eye. So can lazy eye be treated? Yes, it has to be treated by treating the causing factor. For example, if it's caused by refractive error, if the child has refractive error in one eye, so we have to treat that refractive error. Lazy eye can also be caused by, for example, cataract. If the child has cataract in one eye, so we have to do surgery for that eye so that it can restore vision in that eye. How soon? We have to do it as soon as possible because we have a deadline to treat amblyopia. It has to be treated as early as possible. The best is before 9 years old. A lot of studies have shown that after 9 years old, lazy eye is a little bit more difficult to treat because the brain has adapted. That person has only one eye or one functioning eye. Another example that can cause lazy eye is squint. For example, one eye is straight with good vision and the other eye has squint, so the eye deviates out. So again, in this situation, the brain will prefer the straight eye and the deviated eye will be neglected. So in this condition, number 1, we have to treat the vision first. Number 2, we might need surgery to correct the position of the eye. So how do we treat amblyopia? Number 1, if the child has refractive error in that eye, we have to correct that eye. For example, that patient has short-sightedness of -200 or -2, so you have to give glasses to that eye. Number 2, we have to train that eye to see because for the previous years, the brain has been focusing on the good eye and this eye has been neglected. So how do we train the brain again that this eye is also functioning? So we have to do a patch therapy. So in patch therapy or occlusion therapy, the good eye will be patched at least 2 hours a day so that the brain will get to know the other eye that this eye is also functioning. So this is what we call an amblyopia therapy. This is the commonest therapy and it is the most efficient therapy so far. So what's the difference between strabismus and amblyopia? Like I mentioned previously, strabismus is squint or misalignment of the eyeball and amblyopia is lazy eye, when the eye looks perfectly normal but it cannot function as normal as the other people. Strabismus can cause amblyopia, but amblyopia does not cause strabismus. These 2 conditions is usually need to be diagnosed by an ophthalmologist. How do we prevent our children from getting short-sightedness? At least not too bad. Number 1, reduce gadget use. WHO has recommended that children less than 1 year old should not be restrained in a chair more than 1 hour at a time. Meaning, if you give your 1-year-old phones, do you think the child is going to sit for 1 hour at a time? Definitely. So as an ophthalmologist, I do not recommend any gadgets for children less than 2 years old at all because it's not good for their eyes. 2 to 7, I will allow 30 minutes a day. That's the maximum a day. 7 to 14, usually I allow 1 hour to 2 hours according. Sometimes they need to do their homework, but even if they need to use their phones or iPhones or tablets for 1 hour or 2 hours, they must follow the 20-20-20 rules. Meaning, every 20 minutes of using the gadget, they have to take a 20-second break to see something 20 feet away so that they will relax their eyes. Research has shown all this new work, even reading, will increase their risk of short-sightedness. We're not too worried if your short-sightedness is about 100, 200, that's fine, that's still acceptable. But we worry when it goes more than 600. Why? Because it poses the danger of permanent blindness. Once you get there, there's no reversal. It can cause myopic maculopathy, it can cause retinal detachment, glaucoma, and also cataract. So all these 4 conditions are very serious and it is happening even now. The youngest patient that I've seen that lost her vision is 34 years old from severe short-sightedness. Okay, so we don't want that. Number 2, sun exposure. So studies have shown, there's one very good study in Taiwan that shows children who play outside will have less short-sightedness, less myopia. How much? 11 hours per week. So nowadays children, in the morning they come to school, go back, go home, they don't have time to play. So I understand, even my children has that limitation as well. So what we do, during weekend, we bring them outside. Outside means not mall, not shopping mall. We have to bring them to the park because we need that sunshine. Sunshine will increase a hormone in our eyeball to reduce the elongation of the eyeball that will cause severe short-sightedness.